Hey guys, it's Ashley Tharp, and I'm going to talk about a patient that was actually seen today in clinic. So it's kind of interesting in the fact that before starting this program, I had very little experience with transgender patients, and this is now my second patient that I'm going to speak about that's transgender. So this is a 40-year-old Caucasian male that identified as a trans feminine or trans woman who presented to the clinic for psychiatric evaluation for possible surgical weight loss via the sleeve gastrectomy. The patient reported, she was assigned male at birth, but has identified as a female for as long as she can remember. Her pronouns were she, her, hers, and herself. She is currently undergoing hormone replacement therapy, or HRT, with estrogen, and reports to be tolerating that pretty well. She has not undergone any gender reassignment surgery and isn't considering it at this time. So she had a past medical history that included hypertension, GERD, vitamin deficiencies, hyperlipidemia, anemia, and a history of pneumonia. She had a psychiatric history of generalized anxiety disorder with panic attacks, major depressive disorder, reoccurring and severe bipolar, and she was not sure on what specifier of the bipolar that she had, 1, 2. She said she was unclear. She was just always told she was bipolar, and we didn't actually have access to her full psychiatric medical records at this visit. So the patient signed the consent form so that we could receive those from the provider that she's seen outside of the hospital that I'm with. And then, of course, gender identity disorder. She reported that she had struggled with anxiety since childhood and continued to have extreme fear of men. She had a history of recurrent clinical depression and states that she remained in a depressed mood. And at the time of the visit, she had a positive depression screening of the PHQ-9 score, which was 16. She reports extreme anxiety with panic attacks and is just not comfortable leaving home. Her panic attack symptoms were intense fear, racing heart, chest pain, and nausea. She said she grew up in a chaotic home. Her childhood was pretty traumatic with a drug-addicted and violent father. She had witnessed physical and emotional abuse. She denied sexual abuse for herself, but said that she was physically abused by her father. Her mother died when she was just an infant, and she was unsure of the reason for that as well. She was raised by her paternal grandparents until they actually passed away, and then she moved in with her maternal aunt. She did have one sister, and her aunt and her sister were her support system. So she was unemployed and had no income. She did receive government assistance. So that was a conversation that we got to have, or my preceptor got to have with her about the realities of affording the surgery components afterwards, so the post-op recovery, and especially with concerns to the vitamins. And the patient echoed those concerns as well. She did have a history of being an emotional eater and admitted to having trouble controlling binge eating episodes, and that this was actually made worse during the COVID pandemic, and she said it was pretty extreme most of the time. She actually, at today's appointment, said that she has not had any binge eating for the last 6 months, but she does feel like she's still an emotional eater. She was on various psychotropic medications that reflected her diagnosed mental health conditions. She said that there was a question of whether she might have been on the autism spectrum disorder, and told that she was maybe borderline Asperger's. She was engaging, she was insightful to her medical conditions and her psychiatric conditions, and she understood all the concerns for surgical weight loss in regards to her safety. So please feel free to look through more of this detailed write-up that I will post after this video. Thanks.